My name is Carly Ripton. My student ID number is 315-7291, and here is my picture ID. And this is the Q&A portion of our AVMA task video.
What is the radiation monitoring device called?
A dosimetry badge.
How does it work to measure exposure to radiation?
It has a device inside of this small package with a clip on the back that is affected by the radiation.
How do we obtain the readings?
We send these off to a company in which they obtain the readings for us and send back a quarterly report.
When should it be worn?
Whenever you are exposed to radiation.
Where should it be worn when taking radiographs?
On the outside of your lead collar.
What is the MPD for veterinary staff annually?
The maximum lifetime is 5,000 milligrams, but annually you have to calculate that per person. So you take a person's age, subtract 18, and multiply by 5. So we are going to do Brandy's MPD here, and she is 38, so we subtract 18 from that, multiply by 5, which is 100. So her quarterly exposure is 14, her yearly is 29, and her lifetime is 499. So she is an adequate exposure.
What are the 3 methods of restraint used for radiology?
Chemical, mechanical, and physical.
What are the 3 positioning aids that you can use for radiographs?
A positioning bun, tape, and tie downs.
What are the physical protective barriers that can be utilized in the radiology suite other than PPE?
You can use lead doors and distance.
How are distance and the exposure setting on the machine utilized as a safety precaution?
For exposure, we want to get the fastest exposure time with the lowest MAS. And then for distance, we want to put as much distance between ourselves and the beams as possible.
Why should no portion, shielded or unshielded, be in contact with the primary beam?
The primary beam is what affects the cells the most. It causes cell damage and can lead to cancer. And the lead protective gear is only used to protect against scatter radiation, so we don't have any protection against the primary beam, so there should be no contact with it.
Why should non-essential personnel be removed from the X-ray suite during exposure?
Non-essential personnel should not be in the X-ray suite because we want to limit any person's exposure to radiation, so if they're not necessary there, then they should not be in the area.
Why should we make every effort to obtain diagnostic images on the first exposure?
Radiation affects animals just as much as it affects people. So the quicker we get those images, the less exposure we have to the radiation, the less we have to worry about any damage being caused.
What is the scientific reasoning for restrictions on a pregnant woman and people under the age of 18 years?
For pregnant women, the fetus's cells are rapidly dividing, so they are much more susceptible to being damaged by the radiation. That has been shown to lead to a lot of cell damage and mental retardation. So we want to limit their exposure to none. And then for people under the age of 18, it shows that an 18% under the age of 18, their bones, skin, and cells aren't completely finished forming yet, so they're more susceptible to being damaged by the radiation.
Very good.
All right, we are going to evaluate our PPE for our X-ray machines. We want to make sure that we don't have any cracks or any heavy wear and tear on this. This has some minimal wear and tear on the outer layer here, not on the lid. On the outer layer, we've got some breaks in here. They've been bitten a few times, you can see, but otherwise they're intact. They just don't look good right. And then we have our mittens that we use, and they are actually looking better than our whole gloves. No really wear and tear on these, and the lead is intact also. We do check these, I believe it's quarterly, with our X-ray machine to make sure that they're still working well and they haven't been worn down, and those were checked recently and they're all good. We also have our gowns here, and on our gowns we also, our thyroid shields are attached, so by looking at our thyroid shield, we don't see anything here. These are relatively new, so they look it, and we don't have any cracks or anything like that on our apron. And other than some dried slobber up at the top, these also look well enough to use. All right, today we're going to demonstrate putting on our PPE to take x-rays. So we put our lid on here, and we're going to clip it around the back, around the front here. Make sure that it's all covering, and then our thyroid shields, which have magnetic snaps on them, we'll put around here. Snap that on and adjust. Okay. And then we grab our dosimetry badges that monitor our radiation. And we put that on our thyroid shield clip. Put our gloves on, and we're all set. Today we're going to be taking the cranial caudal view of Buddy Boy's here, left radius and ulna. So we're going to input him into our computer. So we will add our patient here. Add his ID. Weighs 5 pounds. He's 5 months old. Alrighty, so we are going to do his left forearm. Do our radius, our cranial caudal. Put that under our doctor. Alright, then we're going to come over here to our technique chart. So he is under 20 pounds, so we're going to go to extremity, and he's going to be on 75 kVp and 3.5 MAS. So we'll set our machine up. Make sure our light is working. Alright, we'll start there. Alright, we are going to be using tape as our positioning aid for him. So, alrighty, get you into position here. Just not hold his head like this for me. Place our tape over his paw here to secure that. Alrighty, we're going to put our marker in here. And then we'll call you make that down. There we go. Alrighty, and then we have our gear on here. Alrighty, and we're going to do a step back. I can hold it for this. Alrighty, and we will take our film. Alright, and then our film will show up here. We'll go ahead and crop that. And since our marker did not make it in there, we'll add one here. Alrighty, and we will send that for the doctor. Alright, today I'm going to show you how to input a patient into our digital x-ray so we can get images of them and have them for our records. So we go into our program right here, and we're going to add a patient. So we're going to put Sadie's information in here. And that is her patient ID that we use on her chart. And her weight, she's 37 pounds. She is 5 years and 9 months old. She's a canine, her breed. She is an Australian cattle dog, and she is a spayed female. We will then go over here and input her owner's last and first name. And then we go here, and we will input the shots that we're going to take of her. So we are going to take a thorax, a ventral dorsal view of her thorax. So we'll add that shot on here. And then we're also going to take a ventral dorsal shot of her pelvis. So we'll add that. And there we go. Alright, so we are going to set Miss Sadie up for her ventral dorsal thoracic view. So we're going to come over here to our technique chart, and she is between 21 and 45 pounds. So we'll look here at the thorax. She'll go between 75 kVp and 3.5 MAS. So we'll come back over here, get our machine set. Turn that down, and then we'll get her ready for her x-ray. Alright, today we will be taking our ventral dorsal x-ray of Sadie's thoracic cavity. So we have her placed in the bun here, in ventral dorsal position. We are going to place the vertical line, our image, just caudal to her scapula, and then the horizontal line will go over her sternum, and we'll collimate that down. Alrighty, we also have our marker in here, so that we know which side when the x-ray is taken. So I have Madison back there, and she is going to hold Miss Sadie's hind legs so that they are straight. We're going to put our gloves on and make sure our lighting. We're going to pull forward, then we will take our image. And then show up here. Okay, today we're going to be taking our ventral dorsal view of Sadie's pelvis for her OFA rads. We're going to consult our technique chart. Sadie is 37 pounds, so she's between the 21 and 45 pound limits. We go down to pelvis. She's going to go on 80 kVp and 5 MAS. We'll go over here, turn our machine on. Alright, so it comes already set on the 80 kVp, and then we'll take our MAS down to 5. Alrighty. Then we're going to tie the front half of Sadie in so we can create a little tension and stabilize her for when we're pulling on those back legs. And we're going to make sure we add our shot over here also. We're going to do body, pelvis, ventral dorsal. Alright, and we'll come over here. We got our machine on. We have our marker in here to show that that is the right side. We will turn our light on. Okay, we are going to place our vertical line over the crest of her ilium. And then we are going to make sure that the horizontal line is just caudal to her patella. Put our gloves on. When we take our pelvic shots, we want to rotate our stiples inwards so that they are parallel. Pull and take our shot. And there's our image. Alright, today we are going to show you how to pull up past images that have been taken on our radiology system. So we want to go in here to our Smart VR icon, pull that up. Here we are displayed with pretty much an endless of the x-rays that have been taken, so we don't have to sort through those. We can search here by a few different things. We can search by the patient's name, the owner's name, the patient's ID, the vet, the tech that was taking them, and the study that was done. So we're going to search for Onyx Woods with his patient ID, which is 70184. We're going to type that in, hit our search icon. We pull up his study, we hit our play icon, and it is going to bring you up all of the images that have been taken for him. Alright, for our contrast study, we're going to be doing a barium study on Willow. Willow is 55 pounds, so she's about 25 kilograms. Our barium is, it says to give 5 to 7 mils per kilogram, so Willow's going to get about 125 mils altogether. The reason we do our barium studies, we're checking for any a pet that comes in for vomiting, diarrhea, anything that kind of makes us want to see how this, how the GI tract is working, how it's running. We do it on animals that are chronic vomiters that have been going on for a while. We do it on animals that we may think could have a foreign body. So the way that we do it is we take x-rays in the lateral and ventrodorsal view. We take them at minute 0, minute 15, minute 30, minute 45, minute 60, and then every hour after that, depending on our doctor's preference or how long it takes for that barium to exit the upper GI tract and make its way to the lower GI tract into the colon.
We are taking Willow's minute 0 radiograph. We have her in right lateral, so we can get a picture of her abdomen. So we'll just take that image. Excellent job, Willow.
Alright, we're going to take the minute 0 VD x-ray of Willow's barium study. So we've got her in the bun, in the ventrodorsal position. We have her arms pulled forward, and we have our machine set up with our marker. So we are going to put the correct marker in there. Alright, got that in there so you can see it, and we're going to take our x-ray. And then our x-rays will come up here. As you can see, we have our right lateral and then our VD, which we're going to have to crop, but you can see the barium in the stomach there.
Hi, my name is Brandy Krieger. I'm a technician supervisor here at VCA Highlands Animal Hospital. I'm also Carly's preceptor. Today I'm going to talk to you a little bit about Carly's radiology course that she's been taking and her strengths and weaknesses and how she's progressed. Carly's biggest strengths at this point are her technique. She does a great job picking those techniques and changing when needed, and also getting those radiographs on that first try without having to redo things multiple times to increase exposure to the animals. The weakness that we've dealt with Carly is a little bit of that collimation, just making sure we only get the bones that we're looking for or just the abdomen, that kind of thing. As a hospital, we tend to be very particular about our radiographs, especially technique and safety. Carly has sharpened all of her skills since the start of her course, and such as collimation and positioning. She also has learned to have a voice when sedation is needed. I look forward to see how Carly progresses through the end of this course, and thank you for your time.